breath holding during physical exercise. It's quite an interesting concept. We've been using it for about 22 years or so. Why would you do it? What might it do for you? Well, let's break it down a little bit. So if you want to force your body to make adaptations, and for those adaptations that you can cope better with lower oxygen and higher carbon dioxide, that you can reduce your perception of breathlessness, that you can add an extra load onto the breathing muscles, and really what you're doing is you're training your body to adapt better and cope with the higher demands of intense physical exercise. And breath holding is strong. It's quite powerful. So, how powerful is it? Well, if we were looking at blood gases, we're talking about carbon dioxide, we're talking about oxygen, carbon dioxide, and we're talking about nitric oxide. If you go for a sprint with your mouth open, your blood oxygen saturation won't change, maybe drop down to about 95% or so, but it's going to be pretty much normal. Carbon dioxide isn't going to change by all that much, might drop a little bit, maybe down to 39 millimeters of mercury, and because you're sprinting with your mouth open, you're not going to get the benefits of nasal nitric oxide. If you want to add an extra load, you can sprint with your mouth closed, but the problem with this is it's quite difficult to do. So sprinting with the mouth closed may not be ideal because, of course, you could cause trauma to your nose, and it's quite excruciating. You can imagine sprinting as hard as you can with your mouth closed when your breathing rate is up to 50 breaths per minute. But in terms of blood gases, when you sprint with your mouth closed, your blood oxygen saturation might drop down to 93%, your carbon dioxide will increase to about 45 millimeters of mercury, and you are harnessing nasal nitric oxide. So certainly, in terms of training, sprinting with the mouth closed is going to impart a better training effect than sprinting with the mouth open, but sprinting with the mouth closed is not recommended because it's too forceful. Let's look at breath holding. So you do a breath hold. Now the breath hold can be during a jog, can be during a run, could be during a sprint. And with this, you exhale, you hold your breath, and your blood oxygen saturation drops down to about 85%. Your carbon dioxide increases to 50 millimeters of mercury, and you harness nasal nitric oxide because during the breath hold, nitric oxide is accumulating. Then when you let go, you're carrying that nitric oxide into your lungs. This is going to cause your body to make adaptations. And if you bring in a few breath holds into your training, into your pre-competition preparation, into your normal everyday routine, you can have an added benefit. And bringing breath holding is a tremendous adjunct to your normal physical training. Simple, know how to do it, and practice it.